Good morning, everybody. We're going to go ahead and give it about another 90 seconds here to let some people continue logging in here, and then we'll go ahead and get started. All righty, it's a little past 11:30, so we'll go ahead and get started here. Good morning, everybody. This is Tyler Finken, Health Marketing Director over at Western Marketing. First off, just wanted to say thank you, everybody, for taking time out of your busy schedules to join us for the webinar today. Today, we have Mr. Thomas Trapala with us. He is the Director of Strategic Partnerships at RSSA, and today we are going to be talking about helping clients navigate the Social Security Administration website and applying for Parts A and B. Before we do get started, I did want to let you know that on the right-hand side of your screen, there should be a questions box. So at any time during the webinar, if you want to go ahead and type a question in there, Thomas and I will do our best to get those questions answered at the end of the webinar. Without further ado, I'm going to go ahead and turn it over to you. Thomas, thanks for being here with us today.
All right, absolutely. And thank you everyone so much for coming on obviously greatly appreciated. We know how busy you all are. And I think this is a great topic because, let's face it, when we're trying to help people start, the Medicare process and Medicare Advantage, supplement, things that you guys are doing, obviously the first barrier or step in that is to get them signed up for A and B. And so today we want to talk about the Social Security website, SSA.gov, kind of the navigation behind that and helping clients through those type of things, either, directly or indirectly, just giving them some guidance. And then the actual application process of helping someone get started on Parts A and B. And again, that could be direct, meaning that you want to help them more hands-on and do it, with them, or just giving them some guidance on how they can get started on that. So either way works really well. And I'll be kind of flipping back and forth here between the slides and the actual SSA.gov website, just to give you guys some real clear visuals of what that looks like, all right? So I'm actually going to start by pulling up the SSA.gov website. And the biggest thing that you want to take away from this, I think, today is that most of the time it is easier to file online rather than over the phone with the local SSA office of that client. The reason for that is that, obviously with Social Security, you might be on the phone for a while. Sometimes they get hung up on, sometimes it could just, take a while to get things through. And, by being able to do things online will make it a lot more simple for you as well as your client. Now, with that first step, usually the first thing that you want to do with a client or that the client would do, and potentially they already have one, is to create an account on this SSA.gov website, right? It's called a My Social Security account, and it will be needed in order for clients to actually file for benefits online. Now, again, there's many different ways to have an account, and we'll talk about that, but essentially you're going to see this sign in button here on the top right corner. And again, whether you're doing this for the client, with the client, or just giving them some guidance, these are some great steps, and we'll provide the recording for this. And just so everyone knows, I also have an FAQ sheet that we'll provide through Western Marketing to you all so that you have those FAQs as we go through this. But let's start with the sign-in process. Now, this is where you would either have the client sign into their account if they already have one, or to create an account if they haven't done so already. Now, prior to, as it's shown here, prior to September 18th of 2021, people were able to use a sign-in with a username and a password. Because everything's a lot more secure nowadays, they want you to either use login.gov or id.me. Whether they have an account already or not, they would just click on whatever account that they have and log in with that information. But more so, what I want to tell you about today is that how clients can create this account if they don't already have one. And again, whether you want to do it with them more hands-on, whether it's guiding them over the phone, through Zoom, or even in person, or just give them that guidance, right? You can even create a sheet that says, here's the steps of how you can do this, right? So there's really not much of a difference with login.gov and id.me. I get a lot of questions of which one should they choose, which one is better. I know the SSA in particular, I think pushes more of the login.gov. And personally, I find it to be easier than id.me. But again, they can do either one. They're both very secure, two-factor authentication, just like anything else now. And again, it's just to protect your client's information, right? There's a lot of scams, obviously, nowadays with Social Security, so they're trying to find ways to protect clients and their information. Now, for login.gov, it's actually through the Social Security website, meaning that it's part of the SSA.gov, whereas id.me is in partnership with SSA. Again, they're both very secure, but it just takes you to a different landing page if you use id.me, where if you use login.gov, it keeps you on the SSA.gov website, all right? So whether you're creating an account for the first time or signing in, all you have to do is click on one of these tabs. Let's just look at login.gov first. So login.gov, again, by clicking on that, will give you the ability to sign into the account if they already have one. They can put in their email, password. Obviously, if they forgot their information, you can click on these links here. And then once you submit, it'll give you a authentication code, which will go to usually your text or email that you can sign into. Now, for creating an account for the first time, you're just going to toggle over to the create an account. And it's going to ask you to enter your email, agree to the rules of use, and then it's going to ask the client a lot of other information, such as their birth date, their Social Security number. It might ask for, just ways to verify that it is actually them. Now, there's a lot of misinformation and fear-mongering and things going on right now that clients will need to go to their local office and show themselves in person that it is who they are. Now, that's not exactly true, okay? There's all these fine prints and there's misinformation. Clients only need to go in person if they cannot identify themselves properly online, right? Most people will be able to do this online without an issue. If for some reason they can't do it online, they will have to show up in person, but it's going to be very few people compared to how many people can actually do this online. If someone already has an account, they've already identified themselves and will not have to show up in person. I really tell you this because there's a lot of clients that are fearing they have to go in person. It's not true most of the time. Now, the one really important thing, whether you're using login.gov or if I go back and we use id.me, which again is going to explain here that you're going to a separate website in conjunction, in partnership with SSA.gov, but it's going to bring you to another page. Okay, so I'll show you what that looks like. So again, it's just showing that id.me partners with SSA.gov. And you could sign in or create an account. Again, you're going to sign in here. You could also sign in with Facebook, Google, Apple, LinkedIn, etc. as usual. You can also create an ID.me account. Very similar questions, whether you're using ID.me or login.gov. They're going to ask for social security number, your birth date. They might even ask, from the last time I did this, they asked for a photo ID and all those different things, right? Similar questions, whether you're using ID.me or login.gov, but the most important thing that you want to steer clients in the right direction for a timeliness type of matter is how they receive the security code, okay? Now, they have all of the usual options. You can get the security code by text, phone call, automation, email, but they also say that they could send the code in the mail, a hard copy in the mail. You want to try as hard as possible to steer clients not to do that for the sole purpose that it might take 30 days or more for them to actually get that code in the mail to be able to get into their account. This will prolong the process of them creating an account, thus also being able to file for Medicare, okay? So clients might not have an email, they might not have a phone number that they can get an automated text or whatever. That's a very different situation. They might have to do it in the mail, but anyone who you can recommend to do it other ways, text, email, things like that, that usually are the two-factor, they want to do it that way to avoid having to wait a long time to get it in the mail, okay? Now, another thing that I've learned over many years of helping clients with this, and again, you can give them directions, meaning that here's, you could sign up for ID.me, you could sign up to login.gov, right? You can give them all the criteria. I'm more like the hands-on approach, right? Kind of doing it with them and really holding their hand through the process. That way, everything goes the right way, right? There's no excuse for them clicking on mail instead of text and all of that. It makes it easier. But again, whatever way you want to help or give them assistance, that's completely up to you, all right? Now, if there's ever a situation where a client is having a hard time getting into their SSA.gov account, there is a little trick that I learned where you can call the main Social Security number. So I'm just going to go to Google and type in main Social Security office number, okay? And the main number is right here, 1-800-772-1213. Now, I learned this trick of the trade, so to speak, by trial and error. And if you call the main number, if you ever have a client that's having trouble getting into their SSA.gov account or any SSA.gov account questions, if you call the main number, and they're going to have an automated message asking, what are you calling about? You know, one of those that say, hey, SSA.gov, thank you for calling us. Please give us a few words as to what you're calling about, okay? Now look up here. I'm going to type this in just so that it's very clear. If you type it, if you say on the automated message, I'm looking for the help desk, it actually brings you to someone who can directly help with the SSA.gov account, okay? Done it many times. It seems to work really well. I'm not sure why that's the key word to use, but just to give you kind of like, you know, an insight of how you can do that, feel free to go ahead and try it if a client needs to get help with their SSA.gov account, okay? Now once their a login.gov or ID.me or account is established, now they can actually start the application process, right? Now for Medicare, they're going to click this middle button here, which says sign up for Medicare, okay? Now, they have a couple different options. They could sign up for Medicare A only, they could sign up for B only, or they can sign up for A and B, right? Depending on their circumstances, which we're going to talk about next. But there's also some great other tabs here, such as planning for Medicare, signing up for Part B only, request the lower IRMA, and other helpful information. All right. Those are some of the things that we're going to be going through today. So next, what I'm going to do is I'm going to switch back to the slides, and we're going to start talking about if a client should actually file or enroll in Medicare at 65 or when they should do it based on their situation, right? So what is Medicare? I think we can all agree we know a bit about Medicare A and B, right? Even though we potentially sell Part C and Part D and all those things, we all know, most of us probably, that Medicare Part A covers hospital insurance and Medicare Part B covers doctors. Now, the big question a lot of clients have is, when do I actually enroll in Parts A and B, right? What does that look like? So for most people, you have to be a U.S. citizen to file for Medicare. You have to be a legal resident, which must live in the U.S. for 5 years in a row, including the 5 years just before applying for Medicare. And then it's typically for those who are 65 and older, potentially younger than 65 if you have a disability for 24 months, and then at any age with end-stage renal disease or ALS. An original Medicare Part A, right? That covers the hospital insurance, hospital stays, inpatient care. This could be hospital room and meals, care in special units such as intensive care, prescription drugs during a hospital stay, lab tests, x-rays, medical equipment, right? All related to hospitals, skilled nursing facilities and services, as well as rehabilitation services after a qualified inpatient stay, is all covered under Part A. Now, Part B is where you get covered for doctor's visits or outpatient care. This includes including when you are in the hospital, an annual wellness visit, flu shots, lab services, x-rays, MRIs, CAT scans, other health programs, right? All of that is included in the Part B. Now, for most people, they will apply for Parts A and B at 65, which includes the 3 months before through the 3 months after 65, right? We all know that that's that 7-month initial enrollment period, okay? Now, the question is, should the client apply at 65? Well, in some cases, they're automatically enrolled, right? If they're already on Social Security, if they are automatically enrolled in Medicare A and B because they're on Social Security, they have the option to drop Part B. Now, Part A, having it at 65 or not, for the most part, doesn't make a difference, right? There's usually no premium as long as you have enough quarters to qualify. It could impact you if you have an HSA, so that may be a reason you want to drop Part A and B. But also, if you are working and potentially earning a lot of money, you may not have collected Social Security net yet anyway. But essentially, if you're on Social Security come 65, you'll be automatically enrolled in A and B with the option to drop those parts. Now, again, for Part A, usually, unless you have an HSA or other circumstance, it's not a big deal to file for Part A at 65, regardless if someone's on a group plan with credible coverage or not, because there's no premium usually. Unless you don't have enough quarters to qualify, then you would have to pay an additional premium to purchase Part A. But for the most part, if you have enough quarters or credits to qualify for premium-free Part A, it might be the primary, it might be the secondary, depending on your group plan situation. But either way, it's not that big of a deal. Now, you don't want to have a client file for Part B at 65 if they're not required to do so because there is a premium. Why would we want clients to pay a premium if they're not required to be on it because their group health plan that they're on is eligible for credible coverage, right? So the criteria of delaying Part B past 65 is that you need to have credible coverage at work with 20 or more employees. You will need to enroll at 65 if your employer has fewer than 20 employees or your coverage is considered not credible, right? This could also be covered under a spouse's employer as well, but ultimately the decision to have to file at 65 or not is important, because if they are required to file at 65 and they don't, they could receive a lifetime penalty, 10% penalty each year of delay, right? And as long as they're on Part B, that penalty will be for as long as they're on that, which could be the rest of their lives, right? Now, there's also, aside from the general Part B premium, there is the IRMA, right? So IRMA stands for Income Related Monthly Adjustment Amount. And I'm going to pull this over for you to show you the different IRMA limits. Now, for 2025, most people will pay the 2025 Part B premium, the regular premium of $185. Now, depending on their income, which has a 2-year look back also, so 2025 is looking at 2023, 2026 will look at 2024, and so on and so forth, they may pay a higher premium up to $628 a month for Part B. And if they are not required to do so because they have that credible coverage with more than 20 employees, then why do that when it's just costing them money and not giving them anything extra, right? So with that being said, the IRMA is very important because when it has a 2-year look back, it doesn't necessarily mean that that client has the same earnings today. So you can file a request for a lower IRMA. So I'm going to bring back the SSA.gov website. Under here, it says request a lower IRMA, okay? This is a form that can be filled out. Again, you can have the client fill it out. You can help them fill it out, right? And it's going to be able to request a lower Part B premium. Not the $185 could be less, but if you're hit with the IRMA, you could file a request to lower that IRMA because you may no longer be having the same income that you had 2 years prior. Now, it's not just earned income from wages. If you have a inheritance, sale of a home, a retirement income, all of that can spark that IRMA. So if you're in a situation where you had a random thing happen where you used to work 2 years ago, now you're retired, or you got an inheritance 2 years ago, you obviously are not making that kind of money. It was just a one-time thing, or a sale of a home. So you can request to lower the IRMA because you're not actually making that money that you were making 2 years ago. And if it just so happens that the next year after that you were still earning, but the current year you're not, you might have to fill out this form again the following year, right? So because there's a 2-year look back and we're in 2025, if you earn too much money in 2023, you might be getting hit with the IRMA today. You could file that appeal. Now for next year, 2026, it's going to look at 2024. So if 2024 something happened also, you have to refill out the form to lower the IRMA for 2026, right? And Social Security is usually very good at lowering the IRMA accordingly, as long as you have proof and evidence of the change, right? Okay, and then here, again, you could just look this up, 2025 Part B IRMA coverage calculations. It comes up here. There's many different ways to see that. This is actually on the CMS.gov website, so that's really helpful. And then the next thing is actually going ahead and potentially helping clients file for Part A and B. Now, again, you can have them file for Part A only, or they could file for Part B only if they're already on Part A, or they can file for A and B at the same time. Again, depending on their circumstances, right? So we're going to take a look at what all of those different scenarios look like. So the first thing is, again, this is the SSA.gov site we showed you earlier. You would click on sign up for Medicare. and then it's going to show us this screen that we showed you earlier. So on this screen, it kind of just gives you some background and other links that you can click on. If you scroll down, it's going to show you the information that you'll need to provide, right? Most of it is very generic information: social security number, city, state of birth, if you still have group health plan, what that looks like, email, and things like that, right? Now, there's two different choices. You can have the client sign up for Medicare, which is indicating you're either signing up for either A only or A and B. Option 2 would be Part B only, okay? So if you're choosing Part A and B or just Part A, you're going to go with the first option, sign up for Medicare. If it's just Part B, then you would click sign up for Part B only, all right? In this case, we're going to assume we're signing up for Parts A and B. So we'll click on Apply Online. And then it brings us to this benefit application terms of service. You would click that you would understand the statements and click on Next. Now, again, you can do this with a client, whether it's over the phone, online, in person. You can give them the criteria to do it. So if they need assistance, any way that you and your client feel comfortable with filling out this application. Now, once you click Next on agreeing to the terms of service, you would click on Start a New Application. In some cases, clients may have already started the application process. Maybe they got stuck. You can also return to a saved application, or if they weren't sure if the saved application actually was filled out correctly and you just want to start fresh, you could just click on Start a New Application. Now, if you're helping a client apply for benefits, that's not really where you would click on, I am helping someone who is not me and therefore cannot sign the application at this time. That's really for a power of attorney, meaning that someone's giving you the power of attorney to do everything for them. If you're just helping a client out by giving them some guidance, you're still going to click on the I am applying for myself, as if you're applying with that client. And then, do you have a My Social Security account? Again, you won't actually be able to complete the online application unless they have a My Social Security account. So again, that's always the first step. Now, if you were to click no, it's going to make you create an account anyway. So at this time, we would click yes, we already have an account, and then we would go ahead and click no. Next. Now, again, you see the same screen, right? So you can sign in with login.gov or id.me. I think most people who used to have a username actually are I think they have to switch now to login.gov or id.me. I haven't come across that situation yet because all of my clients that I've worked with have login.gov or id.me already. But I'm sure that if they have a username, they're probably steering them to create one of these more secure accounts at this time. And then once you are logged into your account, it's going to actually start the application process. Now, anywhere where you see highlighted in yellow, because this is a real application, I just crossed out the name, social security number, and date of birth, but all of these things would be pre-populated because of that My Social Security account. So the very first thing after that you're answering is some general questions. Gender, it's going to ask, are you blind or do you have low vision even with glasses or contacts? Now, you can, most of the time these questions are basically asking about if you're going to need additional help because you're blind, or, if you are going to be applying for disability. So most of the time this question will be no. Even if you have a client with glasses, they would have to be blind enough or to a point where they can't actually fill out the application on their own, or they're applying for a disability benefit. So just be wary that most of the time this is still going to be no, even if your client has glasses or contacts. It's really indicating, are you blind or can't see enough to be able to fill out this application on your own. And then kind of same thing with the next question. During the last 14 months, have you been unable to work because of illness, injuries, or conditions that last up to 12 months? If you put yes, it's going to indicate that you want to apply for disability benefits or that you need help with the application. So if you just had someone that was ill or, got sick. That's not really what they're asking. They're asking, is this a long-term thing that has lasted at least 12 months in which you probably want to file for disability or you're going to need help with the application. So most of the time, this probably will be no as well. And then you'll go ahead and click on next. Now it gets into the kind of demographic information, right? It'll ask for the mailing address. You would put in the street, the city, the state, and the zip code. Ask them if they live at this address. If they don't, and you click no, it's going to ask another address of where you live. And then phone number, you're going to put in the 10-digit phone number, as well as it asks for, is it a cell, landline, or potentially a Skype or something that would be for, out of the country, and then the best time to call. So 9 to noon, noon to 5, or any time between 9 and 5. Now, on that same page, it's going to ask for the person's email address. Now, if they don't have an email address that they use often, most people probably have an email address that they have, but make sure that they have access to it, meaning that, Social Security might send emails to them and that they'll need to see. So just make sure they put in an email address that they actually have access to and that they check periodically to make sure that they don't miss out on anything that was sent to them. And then for the ability to communicate in English, as long as you have clients that can speak and understand and read and understand and can write in English, you're going to put yes to all of these. If you happen to have a Spanish-only speaking client or another language, just put no, and then it's going to kind of ask for what languages they do speak. And then preference, right? So this is more if you have a bilingual client who, can speak English and maybe Spanish, and they have a preferred language to speak and read. Social Security just kind of asks all these questions so that if they call, they know what language to speak and everything like that. So just answer those accordingly. Now, the next page will ask for the place of birth information. Now, for the city and state, it needs to be what is on the client's birth certificate, not just where they grew up or, where they spent most of their childhood. They want the actual city and state that's on their birth certificate. And then the next question is, are you a citizen? And if you click no, it's going to ask if you, again, are a resident, have a green card, all those things. If it's a yes, it's going to ask you if you're a citizen born in the U.S. or if you were a citizen born in another country who gained U.S. citizenship. So again, most of the questions are pretty straightforward, but going through this with clients, making sure that they understand is really helpful. Now, the next thing is the Medicare information, right? So this question is written very confusing for most people. The question is do you wish to apply for Medicare only, but not for monthly retirement cash benefits? It just confuses most people just based on the way that it's written. But really what this is asking is that, are you applying for just Medicare, or are you applying for Medicare and Social Security retirement benefits? So if they're applying for Medicare only, you're going to put yes. If they happen to be applying for Social Security and Medicare, you'll click no so that they also do the Social Security application. Personally, I'd rather do, and I've done the application separately, completely separate application for Social Security than for Medicare instead of doing both at the same time, just to avoid some confusion. But again, if you're just helping them with Medicare, whether it's A only or A and B, you're going to put yes. Do you wish to apply for Medicare only? The answer would be yes. And then it's going to ask, are you already enrolled in Medicare under a Social Security number other than your own? Most of the time this will be no, but if there's a yes and you're, eligible under another record that you're already on, then go ahead and click on yes, but most of the time I think that would be no as well. And then it's going to give you a re-entry number. Now the re-entry number is good to keep. It's also a confirmation number. That way if you need to stop the application and go back in, or use this as a confirmation number to see where your client's application status is at as well. So make sure you write that down, make sure the client writes that down and has that information. Next, it's asking if you want to enroll in Medicare Part B. So remember, when you're doing this application, it's automatically assumed you're obviously enrolling in Part A. But now it wants to know, aside from Part A, do you also want to enroll in Part B? Yes or no. If it's a no, okay, no problem. If it's a yes, go ahead and click that. And then it's also going to ask, are you receiving Medicaid, right? State health insurance, yes or no. Okay, so pretty simple questions. Now, next it's going to ask about the group health plan information. Now, if someone doesn't have a group health plan, you're just going to click on no, and usually no other questions are going to be asked because it would be irrelevant. But if there is a group health plan that they're covered under, it's going to want to know more information based on the employment information and the actual health insurance information. So if you do click yes, that you are covered under a group health plan, whether it's under you or whether it's under your spouse, you would enter the employment information, when the employment started, when did it end, or is it still going? Same with the healthcare. When did it start? When did it end? Or has the healthcare not ended? It also leaves you room for remarks, right? So if you want to put any information in here, most of the time people kind of leave it blank, but it gives you an opportunity to put in any, dates, amounts, whatever you want to do, right? Just all the different information on there will be seen by Social Security, and they'll take that and give you a call, or your client a call if they have any questions. And then simply after that is the electronic signature agreement saying that you're applying for this, and you go ahead and click submit now, and that's pretty much the application process. Now, the application, for the most part, usually happens within 4 to 6 weeks. However, with everything going on, Social Security has been slower. Every office is different. You might have someone who gets it in 4 weeks in one state or even one town, and then the other town or other state could take, 10 weeks, right? You really don't know what you're going to get. That's why if you're helping someone with Medicare, that 3 month before through 3 month after initial enrollment period, you're better off just doing it the first month, available, which is that first month in the 7 months. Just do it as early as possible. Obviously, it's not going to start till the birth date, but it's just an easy way to make sure things get done in a timely manner. And then, yeah, that's pretty much it. So if you guys have any questions, Tyler, feel free to come on and ask me any questions that anyone has, and I'm happy to do that at this time.
All righty. Well, thank you, Thomas. Certainly appreciate the info there. That's definitely really good info, especially if this is the first time that you're seeing this, or if maybe you just needed kind of a little refresher on how to assist your clients with that. So I do see a question here, and this is a new one for me. Thomas, I'm going to ask it and see if you've heard of this. It says, have you seen or heard anything about the use of AI chatbots when calling the main Social Security number that is causing a lot of headaches with seniors trying to advance within the call tree? I have not heard anything about that. Have you, Thomas?
I have not heard anything about that either. I would assume that Social Security probably is going to use some kind of AI. Everyone is pretty much now. It's becoming a big thing. But like I said, the reason why we want to do this webinar today is to kind of tell you that you can really be the one to help your clients with these things. And again, if you don't have the time and want to spend a lot more time with your clients, just use this recording to create like a step-by-step guide and provide it to your client and say, hey, here's the steps to create an account. Here's the steps to file for A and B. If you need help, give me a call. So take this to your advantage. We're going to provide the recording. I have a great FAQ sheet that answers a lot of questions we may not have gotten to today, so you can take a look at that. Tyler will send that out. And what else?
That looks to be the only question that we had come in. So great job, Thomas. Explained it very, very well.
Yeah. Well, so if anyone has any additional questions, again, you may have heard about the RSSA program or not. If you're interested in learning more, RSSA is a Social Security education and technology company. We're a designation to help your clients with Social Security, not just on the Medicare A and B, but retirement, spousal, survivor, different kind of benefits. If you're interested in learning more, there's no pressure, but if you want to get the information or be invited to a webinar to learn more about that, just reach out to me. My email, you can see on the screen, thomas.trapala@rssa.com. If you ever have any questions about Medicare A and B, if you ever need my assistance, reach out as well. But Tyler, thank you so much for having me on today. I really appreciate it.
Yeah, absolutely. And we did just have a couple questions come in right at the last second here, Thomas, if you've got a couple more minutes.
Yeah, absolutely.
All right. This one says, can you apply for Part B only on SSA.gov?
Yeah, so that was the other option. You can apply for Part B only. We didn't go through that application, but it's going to be very similar questions, right? It's going to ask about the group health plan that they were on or that they are on. Essentially, all of the questions you saw, it's going to be very similar to those, but it allows you just to apply for Part B, especially if they're in the special enrollment period, right, the SEP, which gives you up to 8 months after the group health plan or the credible coverage ends. The client has up to 8 months to get on Part B without penalty.
Okay. Next question says, can a person enroll without an email?
Most of the time, I think an email is necessary if you want to apply online. You might be able to call them and apply without an email, but I think if you're applying online, they request an email. I would say that any client who doesn't have an email, I would just create a simple Gmail email with them. Just go on Google and just go to Gmail, create a real simple email that they can have access to, and just use that one. I think that might be an option for them.
Okay. A whole bunch of questions coming in now. Hang on a second. Oh, they're all over the place here. Would the remarks field be a good place to emphasize your desired start date / effective dates?
It depends. You could always put that. Most of the time, if you're in the initial enrollment period, the start date is going to be, obviously the birth date. I think it's like the day before or day after your birthday, something like that. Usually that's standard. But if it's like an SCP thing or if there's, some other situation, you could always put it in there. It can't hurt. There's no downside to adding an extra information in there. That's what it's for.
Okay. Next question says, what do you do if you are signing up for A and B after 65 and are still working? How do you upload the employer form?
Yeah, so I believe there is a spot to do that. I might have that in the FAQ. I know I've gotten that question before, and there is a spot, I believe, to do it. I'll have to get back to you on that, but I believe someone on the last webinar I did said there is a spot where you can upload it. I got to look into that, and I'll let you know.
Okay. This question says, if a client is in my office, can I help him enroll on my computer, or must it be on his personal computer because of the IP address?
No, you can do it on any computer. I've helped clients on my computer without an issue. Again, you're just kind of having them do it, or you're doing it with them, for them, and yeah, that's any way that you and the client feel comfortable is not an issue.
Alrighty, that appears to be all of the questions. So certainly appreciate everybody's time today. Thanks again for taking time out of your schedule to jump on this with us. Thomas, thank you again for going with us. That was definitely some great information. If anybody has any further questions, Thomas's email is right there on the screen, or feel free to reach out to us at Western Marketing. We'd be happy to answer any questions you may have as well. Our number is 800-852-7152. Again, that's 800-852-7152. Thomas, anything you want to add before we go?
No, thank you so much, everybody. Hope you have a great rest of your week, and speak to you all soon.
All right. Thanks, everybody. Have a great rest of your day, and have a great weekend.